And the link between the two depends on implementation, institutional capacity, accountability, and those are precisely the things that the report found to be deficient. A large number might suggest that the problem is solved. A small number might suggest that the solution is simply to spend more. Neither conclusion is warranted. What this report does instead is examine what the pattern of spending says about priorities and why the structures needed to turn spending into outcomes are not currently working. So what we did measure, we examined 9 years of the approved estimates of expenditure from 2017-18 to 2025-26 across 8 categories of child-relevant spending. These are the categories most commonly used, though with some variation in UNICEF's studies similar to this all across the globe. What matters is not the quantum, it is where the money goes, whether we're getting the outcomes we expect, and how we can do better. So put another way, the report does not assess whether Jamaica is spending enough or if it should spend more, but whether allocations are structured to translate into outcomes, a question that requires examining the conditions of delivery rather than the totals of appropriation. Here's what we found. When we talk about investing in children in Jamaica, we almost always mean education. Education dominates. It is by far the largest category of child-relevant spending in the estimates year after year. Jamaica spends more of its GDP on education, as I said earlier, than comparator countries and even more than richer countries, and yet learning outcomes remain low, human capital scores disappoint, and importantly, Jamaica, which has the lowest productivity in the Latin American Caribbean region, only Haiti and Cuba are lower than us, has a workforce whose productivity does not reflect the investment. Part of the explanation lies not just in how much is spent on education, it lies in what is being spent or not spent before children ever reach a classroom. The most consequential period of a child's life is the first 1,000 days, from birth to its 3rd birthday. This is when the brain develops the fastest, when nutrition deficits become permanent, when neglectful parenting leaves lasting dysregulation. Where a child lives and grows in these early years, the composition of the household, the geographical location, the volatility of the community, these have an outsized effect on who that child becomes. The rate of return on investing in this window is higher than at any later stage. The negative experiences of toxic stress, poor nutrition, inadequate stimulation can reduce adult earnings by up to 25%. What happens in the first 3 years leaves a mark that no subsequent investment can fully erase. Not a good primary school or a great high school, not a scholarship, not a well-resourced education system. The first 1,000 days are largely outside the education budget. They belong in health, in housing, in nutrition, in child protection, in social protection, which are precisely the categories where Jamaica's spending is the thinnest, the least protected, and the most opaque. Education spending cannot deliver its potential returns where the foundations were not built. Jamaica is investing heavily at the wrong end of the developmental timeline. This is a structural issue. There's a second structural problem running across almost every category we examined. The budget exists, the allocations are there, money is being spent, but an increasing share of every allocation across almost every sector is going to compensation of employees, salaries and wages for the people employed to deliver these services. And a correspondingly shrinking share is going to goods, services, and operational resources that actually deliver it. In education, compensation of employees absorbed roughly 83% of the budget in 2017-2018, and by 2024-2025, that had increased to 86%. The same pattern holds in child protection, food and nutrition, and recreation, culture, and sport. In 2022, the government implemented a major public sector restructuring. It was a rational response to long-standing wage compression. Teachers, social workers, public sector workers, broadly speaking, should be paid more. But it was not accompanied by a corresponding increase in operational budgets. So the wage bill went up, but to date, and maybe it's too soon to say, improved services have not followed. Money is being spent, it's not reaching the children. If we take a closer look at recreation, culture, and sport, we'll see how all of these issues that I've just been talking about come together. Recreation and culture and sport receive less child-relevant expenditure than any of the other 7 categories that we examined. Less than 2% of the total, declining in real terms across the entire review period. Compensation of employees has risen from 37% to 57% of category spending, further compressing the little operational budget that had existed. In sports and chase are 2 of the major spenders in this area, but their contribution cannot be established from public documentation because they're not traceable in the government estimates in a form that allows expenditure analysis. We also looked at the commitments in this sector, and the fulfillments of commitments were also found lacking. In 2018, the government committed to developing a national safeguarding framework for children in sport and culture. 7 years later, no publicly verifiable output has been identified. The commitment to develop CHAMPS as a premier global track event has no traceable dedicated budget line. We consider ourselves a cultural, creative, and track and field superpower, but we are not funding the conditions that produce it. There's a thread that runs through everything I have described and across all sectors. It persists because there is no mechanism to make these failures visible and no consequence for leaving them unaddressed. Across every sector that we examined, across every category we examined, we found no performance frameworks linking expenditure to outcomes and no disaggregated reporting connecting spending to what children actually received. So the estimates tell us what government intends to spend, what it plans to spend, what it spent the previous year, but it does not tell us what was delivered, to whom, or with what result. No requirement to report on outcomes mean there is no onus to achieve them. The absence of data is not just a data gap, and this is a finding of the report. It is an accountability gap. The report covers a lot more ground than I have been able to do here this evening, and I would encourage you to read it for the full detail. And so we have 5 recommendations in the report, 4 of which I'm going to share here, 2 of which are not covered in the report, but I'll give a brief explanation of how those recommendations came about. And the first is kind of the obvious one, is that government introduced child disaggregated reporting requirements into our public financial management framework, requiring ministries and agencies with child-focused mandates to report child-specific program targets, output indicators, and prior year outturn, meaning what they actually spent the previous year, in their annual budget submissions, embedding this in statute over time to ensure continuity across administrations. We need to shift investment in our children towards the earlier and the earliest years of the life cycle. The budgets for early childhood health, nutrition, housing stability, child protection, and family support must be grown at a rate commensurate with the evidence on where the returns are highest. Recommendations 3 and 4 relate to child protection, though we didn't go into detail in the presentation. The child protection system has its own institutional weaknesses and allocation asymmetries, and the report flags it in particular need of stronger accountability measures. One of the recommendations in the report is related to child protection, and it is specifically related to children in state care who are overwhelmingly placed in institutional settings rather than family-based care, even though we know from overwhelming evidence that they have poorer outcomes, that it is a higher cost on the public purse, and that this is against the government's own stated commitment to deinstitutionalization. The report is recommending a structural shift by establishing a permanency planning framework for children in state care underpinned by a revised adoption statute, a domestic foster care financing model, and a case management protocol that moves away from the operational default of institutions to family-based placement, with a strategic plan to move away from institutional care completely. No more children's homes. And finally, one very specific and time-bound, time-sensitive recommendation that sits outside all the thematic clusters. I don't know how many people remember when the Prime Minister announced this wonderful Hope for Children Trust Fund in 2024. It is supposed to have its seed funding this fiscal year. The government needs to create the legislation for it and appoint a fund manager to fulfill its commitment, its very important commitment to children. What this study found, in one sentence, is that there is a gap between what we spend, what our children receive, and the country that we become as a result. It's not just children are the future, it is about the country that we are and the country that we want to become. Jamaica has solved harder problems than this. The fiscal consolidation of the past 15 years, the restructuring of public debt, the restoration of macroeconomic stability, the rebuilding of fiscal space, all of these required political will, institutional discipline, and difficult decisions across successive administration, and it worked. In having solved that problem, it has created the conditions for us for the first time in a generation to have the fiscal space to get what we do for our children right. We are not a rich country yet, but we can afford to do better by our children. We can afford to invest in our children in a way that we know where the money goes and we get commensurate returns. The question is not whether Jamaica can track what we spend on children. It's not whether we can measure what they receive. It's not whether we can treat every dollar as an investment in our country's future. The question is, are we going to choose to? Thank you.
Thank you so very much, Dr. Thorburn. Put your hands together for her once again. Setting some gears churning, I'm sure, for many persons, because you recognize, ladies and gentlemen, that Jamaica is, as is usually the case in many instances, well ahead of the game. We are spending a lot on education. But the findings, and we'll discuss a little bit more in our panel discussion. But at this juncture, I'm going to give the opportunity for us to hear the ministerial response from Dr. Stephen Carr. Please make him welcome.
Good afternoon, everybody. Ms. Olga Izaza, representative of UNICEF Jamaica, distinguished representatives of UNICEF and CAPRI, principals and staff, colleagues from government entities and our development partners, our diaspora representatives, teachers, students, ladies and gentlemen. I bring greetings on behalf of Senator Dr. the Honorable Dana Morris Dixon, our permanent secretary, Major Dr. Kassan Troop, and the wider team of the Ministry of Education, Skills, Youth, and Information. I am very pleased. Where I sit at the ministry, we do policies. I'm pleased that we're an opportunity to create policies to address the issues that we speak of today. So I'm pleased to join you this afternoon at the launch of this particular report. First of all, let me first commend UNICEF and CAPRI for producing what is clearly a serious and thoughtful contribution to the national conversation about children, education, and development. Reports like these are important because they challenge us to look beyond simple questions such as how much money are we spending? And instead ask deeper questions. Are we spending wisely? Are programs reaching our children who need them most? Can the public clearly see where resources are going? And most importantly, are children's life actually improving because of these investments? These are fair questions. They are necessary questions. And the ministry welcomes this discussion. Now I also want to speak directly to the students in the audience. Sometimes when people hear discussions about budget and public finance, it can sound distant or complicated. But really, this conversation is about you. It's about whether schools have the resources they need. It's about whether students can access textbooks, digital devices, and safe classroom. It's about whether a child with special learning needs get proper support. It's about whether young people have opportunities to succeed regardless of their background and or community. So when we talk about public financing to children, we're speaking about investing in Jamaicans' future. The report correctly highlights that Jamaica must improve how child-focused spending is tracked, evaluated, and connected to outcomes. That's an important point, and the one that the ministry takes seriously. At the same time, we must also